let me turn it up to the Secretary, who clearly has been a champion on providing access to affordable and accessible health care his whole life.
So to Dr. Becerra, to Congressman Becerra, it's great to have such a champion as the representative for the Sacramento County area, and to have a good friend as well that we can turn to for some good guidance and advice on policy, and certainly, of course, on healthcare policy as well. And to Dr. Byington and all the team at the UC healthcare system generally. Certainly Sacramento is very fortunate to have one of the gems of healthcare in its ranks, but it's also the UC system as a whole. We are very fortunate in California to have the best university system in the world in our state, and certainly the UC health system is as top ranked as you can get. So we're very fortunate, and you see the results. California's benefit. One of the things that I think California will see now is even further opportunities through the UC health system, just generally, better health care, more affordable health care. The fact that Congressman Becerra and his colleagues were able to pass legislation that has evaded presidents and Congresses for decades. Up until a week or two ago, I was actually prohibited as Secretary of the Department of Health and Human Services from trying to get the best price for prescription drugs for 65 million people who receive Medicare. I could not. I was prohibited by law from trying to get the same kind of price for that same medication that people around the world get in other countries for the 65 million people in Medicare in America. And more often than not, that drug was manufactured in the U.S. And so to all of a sudden break that bad habit and now let us, for the first time in our nation's history, negotiate the best price for prescription medication is absolutely phenomenal. And I think we owe Congressman Becerra and all of his colleagues a great deal of gratitude for giving us an opportunity to start to bring down the prices of prescription medication. But fortunately, they did even more than just help us negotiate for better prices. They also made sure that we capped into the future the price that Medicare recipients will now pay out of pocket for their medications. I was in New Mexico where I heard the story of a woman who was paying about $90,000 a year for her prescription drugs. That will now get capped to $2,000 maximum. That's huge. But then you think what else Congress did with Congressman Becerra there as well. Insulin now will be capped at $35 a month for Medicare recipients. How many people in America are paying hundreds, if not thousands of dollars for their insulin every month? $35 a month. All of these things are in that legislation. And on top of that, Congress decided to also make sure that we kept the Affordable Care Act, Obamacare, health insurance premiums low enough to keep 13 million people who are now in the Obamacare program, in the Affordable Care Act Marketplace program, affordable, so that those folks, those 13 million people, will continue to have health insurance. And as I tell people around the country, for those who don't believe that President Biden was serious about trying to reduce the cost of medicine to make it more affordable for more people, then you have to take a look at the fact that today in America there are more people who have access to health care through their health insurance than ever before, and there are fewer people, obviously now, in America who are uninsured. We have now reached a point where only 8% of the population in this country does not have health insurance. And so we are continuing to make improvements, but without a doubt, what Congressman Becerra and his colleagues did in passing the Inflation Reduction Act will pass along a lot of savings to many Americans who need it at this particular time. So I'm thrilled to be here in my hometown with a great member of Congress who's also a physician, and Dr. Byington and all of her team at the UC system who have been working hard to make sure people have health care. And let me now turn it over to Dr. Byington.
Thank you so much. I am honored to be here representing the University of California Health System. When I was invited, I was thrilled to come so that we could share our gratitude with Congressman Becerra, Congressman Becerra and Secretary Becerra, for the Inflation Reduction Act, which is really an act that is life-saving for patients across California and for the employees and retirees of the University of California Health System. So again, I am so honored to be here and so grateful to the Congressman and to the Secretary and to President Biden for this act, which is really life-supporting for California. Thank you.
At this time, we'd be happy to take a couple questions from you.
What do you say to Californians who might ask, when will I see the costs lower? When will that affect go into it?
So the legislation has some of these different programs kicking in at different stages. So very soon, beginning next year or so, Medicare recipients will begin to see the $35 cap on their insulin charges on a monthly basis. Soon after that, about the following year, you will see the caps on how much they'll have to pay out of pocket for their prescription medication. And then probably about the next year, we will actually see the benefits of having negotiated better drug prices for all those seniors on the 10 most expensive drugs that we see in the Medicare system. All those things begin to kick in. There's also something that kicks in even sooner than any of those, and that is the requirement now that if any drug manufacturer decides to charge more for that drug than the cost of inflation in any particular year, they have to rebate that extra amount back to the Medicare program. And so if this year a particular drug cost $100 and next year they wanted to charge $150 for that drug, but inflation only went up, say, 5%, so it would be $105, that manufacturer would have to rebate the excess over $105 back to the Medicare system. That kicks in really quickly, so people will see savings, and the most immediate savings will occur for those 13 million Americans who now have health insurance through the marketplace under the Obamacare program. That will continue forward. They will be saving the average, meaning some will save more, some will save less, but the average amount of savings, $800 a year.
And for the 8% of Americans that aren't insured, what is your agency doing to close that gap?
Well, fortunately, in a place like California, that's taken on efforts under Governor Newsom's leadership to increase access, that number should be even less moving forward than 8%. But for those who don't have health insurance, I would say a couple of things. First, please inquire, because you may find that you actually do qualify. Chances are you'll either qualify for Medicaid, or if not Medicare, depending on your age, or you may qualify under the Affordable Care Act, the Obamacare program. And if none of those, then places like the UC Health System, which offer charity care, are always available. We don't deny anyone in America health care. You can walk through the doors, typically, unfortunately, it's the emergency room. You will get care. It's very expensive care to do it that way. And what we want is for those remaining 8% of Americans to know that there's a better way for them and for all of us as taxpayers to get their health care. We'll get there. And that's what the President talked about. That's what so many of us have fought for years. I know Congressman Becerra, Dr. Becerra has fought for that as well, is to make sure that everyone has access to health care. It should be a right, not a privilege. And Dr. Becerra may want to add.
You know, I would just add, again, as lifelong Californians, one of the reasons we're proud to be Californians is we actually believe everyone should have access to health care. So when we talk about where that 8% is, unfortunately, some of my colleagues in Florida or some of the other states there have not taken the same approach we've taken in California. And I would just, share with those colleagues that have chosen not to lean into what we've already provided through the Affordable Care Act. It's good for your state. It's good for your residents. Look at how we're doing here in California and how we are trying to keep people healthy. So we will continue to work with some of those governors who have chosen not to accept some of the benefits that we've already passed and provided in Congress, and hopefully they'll see the light one day.
I think we're on time, so we'll have to call it there, but let's do a quick photo before we head out.
Thanks all very much. Thank you.
Produced by the U.S. Department of Health and Human Services.